Welcome back to the YouTube channel of Shree Swaminarayan Physiotherapy College. I am Stuti Shah and today we are going to learn about joint movements. In my previous video, we have already learned about the axis and planes. That is, you had your vertical axis, your frontal axis and your sagittal axis, and then you had your sagittal plane, your transverse plane and your coronal plane, that is also termed as your frontal plane. Today we are going to see how these movements are occurring in these axes and planes. Whenever we are talking about joint movements in relation to axes and planes, we will always consider the body in its anatomical position. This is considered to be the anatomical position of your body. Now let's look into the first set of movements. The first set of movements is your flexion extension occurs in your sagittal plane and frontal axis. This is considered to be shoulder flexion and this is considered to be your shoulder extension. When you're talking about hip, this is hip flexion and this is hip extension. For your elbow, this would be considered to be elbow flexion and this is elbow extension. For your knee, this is knee flexion and this is knee extension. When you are talking about your wrist movements, flexion extension, this is wrist flexion and this is considered to be wrist extension. For your fingers, this is finger flexion and this is finger extension. When you are talking about ankle, this is dorsiflexion, this is plantar flexion. Your dorsiflexion and plantar flexion is going to occur in your sagittal plane and frontal axis. The second set of movements which we are going to talk about are in your frontal plane and sagittal axis. These are your abduction and adduction movements. This is considered to be your shoulder abduction. When you bring your arm back down, this is considered to be your shoulder adduction. Similarly, for your hip, this is considered to be hip abduction and this is your hip adduction. In your wrist, this is known as your radial deviation and this is known as your ulnar deviation. Your radial deviation and ulnar deviation is occurring in your frontal plane and sagittal axis. In your ankle, when you're doing inversion and eversion, these movements are occurring in your frontal plane and sagittal axis. The third set of movements which we are going to talk about are going to occur in your transverse plane and vertical axis. These are your internal and external rotation. When you're talking about shoulder, this is considered to be your internal rotation of your shoulder. And when you take your arm out like this is considered to be external rotation of your shoulder. For your hip, this is considered to be external rotation and this movement is considered to be internal rotation. When you're talking about movements in your thumb in relation to axis and planes, there are few changes. So this is flexion, this is extension. This movement is occurring in your frontal plane and sagittal axis. Now, when you're talking about the movements of abduction and adduction in thumb, this is thumb abduction, this is adduction of thumb. This movement is occurring in your sagittal plane and frontal axis. Hope you had a great learning time. Please do not forget to like, share and subscribe our YouTube channel. Thank you.